are conducting an exploratory ethnography on bicycle. We are exploring the city, my student and I. Really at the core, our core research question is around well-being. How are folks in Grand Rapids doing, related to the pandemic, recovering from the pandemic, and how are people getting along and feeling in terms of mental health and overall well-being. We're especially looking at three factors and how they influence our overall well-being. We're looking at religion, we're looking at community or social networks, and we're looking at public spaces such as parks like this one here, Garfield Park, or other spaces where folks gather in public.
We've been looking at a lot of different factors that might be influencing people's mental health, so we kind of came up with and have found that the three things that we're really interested in around this topic are community, religion, and social spaces. This is kind of partially because of some of the research I've done in my capstone classes and other sociology classes, and also just where our interests lie and where we thought people might have a lot to say, and those have been some of the most important conversations we've had have been around those three kind of main topics.
We're conducting informal interviews on porches, so we're biking around the city talking with people on porches or stoops or at garage sales or on sidewalk spaces to hear about their lived experiences and perceptions about people and their lives in Grand Rapids. This is something that also, by doing this research on bicycle, we've been able to observe in really interesting ways. So biking, for example, Aquinas and Southeast quadrant, biking through Southeast, and then we'll say up into Northeast through like Heritage Hill, down through Medical Mile, where you see this flourishing health industry, and then over across the river into Northwest area, which is more working class, more ethnic communities, then down into Southwest, which is more Hispanic communities, and there's lots of physical barriers with the river and the highways and the railroad cutting through. So you really see the variations in the neighborhoods, the kinds of homes, the way that they're maintained, or the lack of resources, like are there food deserts throughout these different pockets, what kind of shops are available or not available, what kind of basic daily needs are being met or not by the kinds of small businesses are in areas or not. So it's been really interesting to see that throughout the city, and certainly to experience that on bicycle.
Well, I've pretty much grown up in Grand Rapids and Grand Rapids culture my whole life, so when we were talking about things that might be contributing to the poor mental health that's found in Grand Rapids, according to some studies, I remember people would say things, or Jen would say, she's hypothesizing about something, and I would think, no, that's not a thing in Grand Rapids. But then as I was talking to people, especially people who came from out of Grand Rapids, I realized more and more there were things that I was so used to because I had been in this specific town and culture my whole life that I never realized were a thing. And for when people come to Grand Rapids from out of town, they experience it much differently than I experience it growing up here, having family here. So I've been surprised to learn that sense of community and belonging that I feel here, most likely because of my family and my high school and my college experience. A lot of people don't experience that in the way that I do. And so I guess I was blind to a lot of the downsides of Grand Rapids, and I think that is actually a theme that's come up, is people who grew up here don't see the struggles that people who didn't grow up here or don't necessarily have strong family networks, what they might experience. My mind has been completely opened up and become a lot more critical of Grand Rapids, and not critical in a negative way, but just looking at it more critically instead of just accepting everything that is.